welcome everyone. Thank you so much for joining us this morning on our webinar with the introduction of the Associate Continuing Healthcare Practitioner. We're going to kick off, have a look at today's agenda, and hope you're all comfortable. Got a coffee. I know it's a bit early in the morning, but we're going to take you through hopefully some really good insightful information today, and hopefully you'll take away a lot from today's agenda. So having a look at a little bit about us. So who are Paragon Skills? Who are we? What we've been doing for the last 25 years and how we can support you. We're also going to look at what we offer, so what programs we can support, not only on today's program, but also a little bit around some of the other programs that we offer as well to the sector. Then we're going to do a real deep dive into the Associate Continuing Healthcare Practitioner Level 5 Apprenticeship Programme. We're then going to have a little look at how we can support the business, how we can support your individuals on programme, and then we'll have a little time for question and answers, and then we'll look at some next steps. So we'll kick off with some introductions. So I'm Gemma Hall, I'm the Head of Business Development here at Paragon Skills. I've also got Lisa Defonso, who's our Quality Improvement Coordinator and our absolute expert in care. She's going to talk you through today some of the technical elements of the programme itself. So who are Paragon Skills? So for those of you who don't know who we are an Ofsted Grade 2 apprenticeship provider with expertise in care. We've been delivering apprenticeships for about 25 years, the last 5 years obviously in the apprenticeship standards, and we're very much experts in care. Our personal trainers are national, so we cover the whole of England. We've got sector-specific personal trainers, so our personal trainers are from the care background. They've got that experience and they really understand the service and settings that they're working in. Our learners really enjoy the programs that we offer, and you can see that through the satisfaction rate that we've got. So 95% satisfaction rate from our learners, and that then follows through to our success rates as well. So you can see a massively above average 72% success rate across the programs that we deliver. And we deliver about 4,500 apprenticeships a year. So we might seem like a small provider for those of you who don't know us, but actually in terms of the care sector, we're actually one of the largest in England. And we've got some really good awards. It's great me sitting here telling you how good we are, but it's always good to see that external recognition, isn't it? So the top training provider of the year, and that was this year, that was voted for by the apprentices themselves. So that's a great one for us. We're really proud of that. We've got the Care Award, so National Care Provider of the Year as well. And you can see some of the other awards across the bottom there. One to sort of bring your eye to is the Centre of Excellence for Skills for Care as well. So we're really proud of who we are and our support into the sector. So a little bit about sort of what we do and how we can support you as a business. We want to deliver outstanding teaching and learning to every learner every time. And in order for us to do that, we believe that there's a few key elements that we can support you with to ensure that we get those fantastic success rates, we get the right people on the right programme at the right time for you as a business as well. So first off, when we're working together in a partnership with our clients, we want to look at that strategy process. So what programs are going to really align to your business? What's going to really align to the business KPIs? What's going to really add value? Is it that we're looking at retention? Are we looking at attraction? Are we looking at productivity within the workplace? Whatever that strategy might be, we want to establish that with you. So whether it's myself or your Paragon Skills expert that you're already talking with, we'll work with you to align the right program to the business and to the right person. And key to that is the engagement that we do around that. So we want to ensure that it's great, we're all here today, we all love apprenticeships, I'm sure, but we want to get that engagement piece across the business. So whether that's from the learner and the learner manager, we want to make sure we've got that engagement, but we also want to make sure that we've got those key stakeholders engaged as well. So we'll work with you to establish a really great engagement process, communications plan, marketing, whatever that might be. We'll work with you as an individual business to ensure that we're really getting that wider business engagement. And then following on from that, we want to ensure that that enrolment process is as streamlined and as easy as possible for both the learner and for the manager. So we'll work to ensure that that enrolment process is as timely as possible, and we're really quite proud of the timely process that we've got here at Paragon Skills. Of course, then we're going to support you in delivering the programme, but as well as the programme, we also deliver functional skills. So we do have expert coaches that support with functional skills delivery as well. We will support with ensuring that you get the reports that you need as well. So we use an online platform for that, and I'll talk you through a little bit about that today throughout the presentation. And then, of course, what we want to ensure is what we're delivering today and is fit for purpose today is going to be fit for purpose in 12 to 18 months' time. So we're going to continually review that process with you. So is it still the right program in 18 months' time? Are we still meeting the needs for the business? Are we still meeting the needs for the learner? And this can be, you know, it's a 12, 18-month process where we're continually reviewing and ensuring we've got the right program for you. So that's a little bit around us and the sort of strategy and how we're going to work with you. What programs do we deliver? So as I say, we are very much experts in care. We deliver programs from level 2 right the way through to the level 5 program that we deliver today. So really giving that full career pathway for your teams. And whether that's aligned to your business goals for attraction, retention, you know, obviously retention is a really key one at the moment in the sector, and retaining those staff, giving them that view of where they're going to be in 5, 10 years time within the business, aligning an apprenticeship to that is really going to help with that. Equally, attracting people into the business at a level 2 or even a level 3 is really going to set you apart from other businesses as well. So we want to support you in doing that. So we support through care, healthcare, childcare as well. And then for the wider business, if we just skip on to the next one, Sarah, we also deliver professional services as well. So we're offering that full home approach. So everything from accounting to coaching professional, and even one of our new ones that we've just started in the last few months is Learning Mentor level 3 as well. So if you want any further information on any of the programs that we offer outside of the one we're talking about today, do speak to your Paragon professional, and they'll support you with giving you further information on those. If it's not myself, I'm sure you've already got a contact. If not, we'll share some contact details at the end today as well. So let's jump in and let's have a look at the program. I'm going to grab a sip of water. Dries your mouth out talking. So let's have a look at Associate Continuing Healthcare Practitioner Level 5. We'll do a bit of a deep dive into the program, but first of all, let's understand who's the program for. It's a little bit of a complex one in terms of the language that we use when we're talking about the program. So we've tried to break it down for you. So where could it be used? So it can be used in settings and services that are planning and commissioning the care for people with complex healthcare needs. So that could be in a community healthcare setting, it could be in a clinical commissioning group, it could be in a social services setting, and there's various settings that it can be used for, and this isn't limited to, you know, there's actually other areas that it could be used for as well. So we're going to do a bit of a question and answer towards the end. So if you've got questions around who the program could be for, we'll flick on to the next one, have a look at specific roles. So it could be for somebody who's working already within a continuing healthcare team. So they might already be doing that role and looking to progress to the next steps. They might have been doing it and feel like they want to upskill themselves further, or they might be looking to move into that role or to develop their career from there. It might be someone that's in a healthcare service who's providing care for a person within their care home or within their actual home themselves. And it could also be used for people who are guiding and supporting those transitioning from childcare into adult care and other care settings as well. So it's a really broad range of areas that it can be used actually, and we'll go a little bit further into that when we start to look at the technical elements for the programme. A little bit of an overview then, just to sort of touch on briefly, what's the programme? You know, how do we deliver? So we deliver the programme over a 24-month period with a 3-month EPA process. Now, that 24-month period doesn't mean it's limited to, so if it's going to take longer, it might take longer, but equally, where we've got those learners that can progress quicker and they're supported massively by the business, it might only take 20 months, but we very much work to the individual's needs, and we deliver on a one-to-one process. So it's a level 5 program. It is the equivalent to a foundation degree. Our endpoint organisation is Steadfast. And in terms of that delivery model, as I say, we deliver on a one-to-one basis. Now that might be face-to-face or it might be remote. We are very much set up for a remote delivery model. Having gone through the pandemic over the last 2 years, we are very adapted to being able to deliver remotely, but equally we're now going back into the workplace as well. So depending on your setting, depending on the individual's role, would depend on whether or not you want us to come out and do those sessions face-to-face. We're very flexible on that. There is an element of self-study around this program. As I say, it is a foundation degree. It is a high-level apprenticeship program. So there is that expectation for the individual to be doing some self-study outside of the time they're spending with their personal tutor. They will be supported with that through our social learning platform, and that's called Bud, and I'll talk you through what that looks like shortly. And they'll have contact with their personal tutor as well, whether that's through email, the learning platform, or through the telephone. They've always got access to their personal tutor to support them through that program and to give them any guidance or answer any questions that they might have. So let's take some time, let's have a think about this. So who could this work for in your teams? You know, if you've got any questions, we've got a question and answer box there. So do feel free to pop in the question and answer box. If you've got somebody that you're thinking of in particular, you're thinking, is this the right role for them? Is this the right apprenticeship? Towards the end, we'll answer some of those questions and we'll start to look at, you know, what are those roles, and we'll have a look at how we can define that a little bit more. But in the meantime, I'm going to hand over to Lisa. We're going to have a little look at the entry requirements, and then we're going to have a look at the technical elements for the programme and how we actually deliver. So Lisa, I'll hand over to you. As I say, Lisa is our expert in care, and she's going to talk you through the programme itself.
Thank you, Gemma. Good morning, everybody. I hope you're well and most importantly warm. It's getting colder this time of year now. So yes, so the programme itself, the entry requirements is you do have at least 2 years experience in the carer capacity for these health and social care provider organisations that you work in, or you have worked within a continuing healthcare team apprenticeship as well. So you do need Maths and English at level 2, and as Gemma said earlier on, we have a dedicated functional skills team to help support those individuals that need supporting with their Maths and English to get them up to the level they need ready for their endpoint assessment. And also you have to be a UK resident over the age of 16 and not in any other full-time education or have equivalent qualifications that is set, because obviously it's an apprenticeship programme. So let's move on. Let's have a little look at deep dive into the programme itself. As Gemma said earlier on, it is a 24-month programme, and within that 24-month programme we have a pathway, which is a really dedicated, interesting pathway for those individuals. And obviously within the pathway itself, there is stepping stone approaches of different aspects of what they will learn and what they will gain through their knowledge, skills and behaviours. Now this pathway itself, we have a robust scheme of work and we have a curriculum. So all of the tutorials, the self-studies, all of the assignments, all the activities, they're all set out. But having said that, it can be very, very flexible as well. So there might be an individual within that programme that's doing something that's in month 20, they'll be doing probably in month 6. So it's not necessarily that they have to follow that pathway rigidly. It's very flexible to those individual needs in those services and settings, you know, the individual learners are in the service setting. So when we look at the pathway itself, they do start off from obviously month 1 down to month 24, and what that looks like and feels like is down to the dedicated expert, subject matter expert individual tutor that gets delegated to those individual learners. And at the start of the programme, they will look at recognition of prior learning. They'll also look at CPD, and they'll also look at you know, completing the skill scan. And that skill scan identifies their strengths and weaknesses and their competencies areas. So it really does give an overview of that individual learner and their needs at that particular time and what's needed. So, you know, between month 1, they have some dedicated self-study and independent learning. Moving on, because obviously with the study skills, it's really important that we get that really set in stone right at the beginning. So they have to learn about their academic writing and Harvard referencing right at the beginning. Moving on to month 2, we have a look at their own emotional intelligence and self-awareness. So they reflect on their own awareness and how that projects to others, because they'll be in a leading role within that capacity. they'll look at doing some tutorial and learn some theory-based evidence around that as well, and then produce some case studies and some reflective practice. They'll also learn about courage, transparency and professional duty of candour. It's paramount within our services and settings that we're open and transparent in what we do, and also highlighting the safeguarding aspects and duty of care with that as well. So they're learning those, theory-based evidence, practical-based evidence, and following protocols and policies and procedures, and those legislations and guidelines as well. And moving on, we look at things like chairing meetings. This is something that they are going to be doing throughout the programme, because it's something that they need to do at endpoint assessment as well. So they'll be taking part, they'll be observing, and they'll be overseeing and coordinating and chairing those multidisciplinary and multi-agency meetings as well. They'll learn about conflict resolution and managing difficult conversations. Within that, and also looking at coaching and mentoring teams, learning a little bit about leadership and management and what that looks like and what that feels like and how that protects with others. It's very important, because as a leader and manager, you want to make sure that you're not only leading and managing and delegating, but you're also supporting and you're coaching and mentoring, and you're looking at people's strengths and weaknesses within teams, and you're promoting that and supporting that as well. So they highlight that, and they obviously have that impact on themselves, but also the impact on the service and setting that they work for as well. So we heavily, look at leadership roles as well. We look at the difference between primary and healthcare and social needs, and referral, discharge and transition of care. And we do that through self-study, theory-based observations. We have observational tools where they use to oversee others within teams as well. And also they have to look at financial and accountability, and also the credibility of themselves and others within their teams as well. And then moving on, when we're looking at things like in from month 13 to month 24, we look at the importance of infection control, and we look at how that is measured. We do tutorials, we do observations and self-study, and we look at policies and protocols around that. Months 15 and 16 as well, tutorials, and we do heavily case study based and assignments on the challenges in commissioning and services, and when providing and reviewing safe care are the needs of those people with complex and comorbidities and social needs. So it's really important that they look at that. They talk about things like travel and distance, which actually, sometimes that can be a challenge as well. And then we move on to months 18 and 19, where we do a lot of tutorial, knowledge base and self-study around the human body, and especially about the conditions. And the conditions could be regards to breathing, could be nutrition, food and drink, continence, skin integrity, which includes wounds and ulcers, the mobility of those individual clients and people that we care for, and also about the communication and the emotional and psychological needs of those individuals as well. So we look at conditions, and we look about the understanding of those conditions, and we look at about behaviours, and also including in that we look at about drug therapy and medicines, and also about other significant care needs as well. So it is really in depth within that, for them to be able to understand about the whole person in themselves and how they can put those continuing healthcare packages in situ for those individuals, and how that continues as well. So when we move on, then we look at, obviously, we have got an in-depth, if you move on to the next slide, we look at the depth of what's involved within those. I have mentioned about a few of those as well this morning, but we can categorise them. So as I said, Harvard referencing and looking at their academic writing and study skills. As I said, this is at higher level, academic level. They will obviously look at about their own self-discovery and recognise about own bias, and looking about empathy and those softer skills as well, which they'll learn, and they'll naturally have those ability of softer skills with the compassion and empathy, which we have in our care services and settings as well. You know, we're looking about obviously the talked about duty of candour, and about obviously patient care, and looking at safeguarding as well. And then when we move on to the other months and move down, and we're looking at obviously those in depth as well, we look at things like, you know, equality and diversity, and also about culturally and the sensitivity, and promoting an anti-discriminatory practice throughout. Looking at people's, you know, individuals and functions, and, you know, how commissioning services and how we can support that as well. We've touched on about the leadership and management of those apprenticeship learners, and about how they learn about how to delegate, how to coach, how to mentor, and, you know, moving on about chairing meetings as well. So they'll do a lot of work shadowing. They'll observe others, you know, they'll be included in others about inclusive practice, and they'll also be able to chair those meetings as well themselves. We do have observation of practice, so those that runs through the programme as well, so there'll be lots of observations and opportunities to work collaboratively with obviously those internal healthcare professionals that work internally with those learners. So those learners will have internal mentors, and how they can provide expert witness testimonies as well for us when we do our remote delivery as well. So moving on from month 10 to month 13, you know, we talked about different aspects of about the body and about the human body, what that looks like, you know, looking at about reviewing healthcare and social care needs of those individuals, and about supporting with the budgets, because obviously it's NHS that, you know, obviously a funding continuing healthcare. So we're looking at, you know, incorporating those commissioning services as well. And then obviously moving on, you know, to moving on to months 14 to 18, we look at primary healthcare needs and social care needs. We go into depth with that as well, and we can explore the challenges which I spoke about earlier on into a little bit more detail, and what that looks like and what that feels like, and how we can, you know, we can provide best practice and look at some of those conflicts and how we can, you know, resolve those moving forward. We look at, you know, about obviously infection control measures as well, which we talked about, which is important within our primary and care needs as well. We look at finances, eligibility, and obviously we look at claims. So we look at in the depth of, you know, what it's like to look at complaints appeals, what that looks like, and how they can get involved in that, and, you know, about the law and about policies and legislation that goes with that as well. Then moving on, you know, coming up to the end of their programme nearly, we've got between month 19 and month 21, and we're looking at, you know, about referrals and discharges, and obviously the continuing healthcare budgets. We talked about conflict resolution as well, what those packages of care look like for those individual needs, and you know, about the continuation of that care as well. So they learn a lot about that and what that looks like, and how, you know, about the reviewing of those care plans and those care packages for those individual needs. Obviously, you know, we said we'll have a dedicated tutor, which are experts in their field as well. So they'll have a lot of support, and they'll have a lot of resources around that and what that looks like as well. And then obviously looking at social prescribing, and you know, about the control measures and about the continuation of those healthcare needs, and in line with, you know, data protection, data sharing, all of that as well, and looking about, you know, the depth of that as well. And then obviously moving on then, you know, we're coming up to the end of the programme. So we do look at about their competencies, their boundaries, their accountabilities and their limitations. They learn about that, they study about that, they look at consequences of practice and how they can learn from that, which is obviously embedded within duty of candour, about that open and honesty and transparent approach across the board. And then obviously in what to do, you know, if those expectations are above their limits and above and outside their circle of influence, and what does that look like, and how they can get that additional support. And then obviously we come to the end of the programme. By then, obviously, we have an EPA passport to success. So that's embedded right from month 1 right to the end to month 23. So when they look at that, they're super ready for the end. You know, they have engagement with, you know, their managers, they have those reviews, they have that contact, and that's really important and paramount, because we want you as a service to be involved in their teaching and learning and assessing what that looks like and how they're doing as well, you know, and the support they might need, you know, along the way. So they are ready. They do a lot of mock assessments, you know, to prepare them for EPA, which is very important, because when they do reach EPA, we have an EPA outline where they have to present to their manager with their tutor on a presentation of the service and setting that they work in. You know, it's a little bit of outline about what they do in their job role, a little bit about what they've done within their programme as well, and about, you know, what they've learned, all those knowledge, skills and behaviours throughout the programme, and how they've met the criteria within the standard. They look at and they showcase that with their portfolio of evidence, and then we have a decision with their manager to make sure that they are ready for EPA. So we don't just put them through. You know, there is a conversation and there is a meeting of all parties to make sure that that person is confident and ready. So with regards to EPA, as Gemma said earlier on, the EPA Endpoint Assessment Organisation is Steadfast. And then what they do, there's 2 parts to their EPA, 3 parts, sorry. So they have a 2-hour workplace observation. Now the IEPA does take part in that, and then that's a conversation that they have prior. So it gets all arranged and planned, ready for that individual to take part in what's a multidisciplinary team, a multi-agency team. So they have to chair that. They have to coordinate that as well, so they bring all parties together and professionals together for one individual. After that, depending on how many knowledge, skills and behaviours they've met within that observation, they then have a 30-minute question and answer session after with the IEPA. They also do have afterwards a 90-minute professional discussion, and that underpins with their showcase of portfolio of evidence which they've collated over the period of that 24-month programme. Within that as well, there is a question and answer, and that is specifically around 7 specific areas of that standard. So all of the plan, the standard plan, is on the Institute for Apprenticeships, which was trailblazed by multiple CCG groups as well. So it's a very much recognised apprenticeship, and is very much well needed within our organisations and our services and settings out there. At the end of that, there will be a decision whether it's pass or a distinction, and they will get feedback as well from that. And then obviously, then we'll get the outcome from that as well. We don't necessarily have to do the observation and the professional discussion. It can be the other way around. So it's depending on the learner. It's depending on, you know, the setting itself and the planning around it. So it's down to those, you know, all parties that can decide on that as well. And obviously, you know, that's a 3-month window there as well. So that's part of the EPA. And then moving on from that, if I want to hand over about the career progression to Gemma, Gemma can talk you through some of the wonderful aspects of how we can get to the apprenticeship, and moving on from the apprenticeship, and what you know, what is out there for them after they've achieved that apprenticeship as well. Thank you.
Thanks, Lisa. Yeah, that was a really good, insightful view of the programme. And I suppose it's always really key to understand, well, where can we go from this programme? What does that career progression route look like? And there's multiple areas that you can go into from this programme. So it's really key to recognise the different roles that you could go into from here. So the management roles, so in specialist services and settings within the care sector, NHS specific roles as well. I know we've got a few people on the NHS on the call today, so there's specific roles within the NHS that will be relevant for the wider community care settings, social services and nursing, and then even CQC regulators. And I suppose what we want to demonstrate here on this particular slide is that career progression from level 2 right the way through to level 5, and how we can support that as a business as well. So So we offer programs that will help support that career pathway, support individuals really see where their career is going to end up, help them visualize that. You know, they might have come in at a level 2 adult care, and then they've now got a view of being able to specialize in a particular program or area like this. So it's really great for us to be able to give that visual to individuals to help support, retain them within your businesses, and also attract them to be able to showcase, you know, in 5-10 years time, this is where you could be within your career within our service. So thanks, Lisa, for that really in-depth view. If anybody has got any questions, do add them into the chat, as we said. I'm going to talk a little bit about our systems now. We've just got a few more minutes left of the presentation. So a little bit about Bud. So Bud is our online learning platform. So it's a really great platform. It's really interactive. It's available online on your desktop or also on your mobile phone as well. So there's an app that you can use to utilize those learning materials and resources. And when we talk about those learning materials and resources, obviously Lisa's gone over the subject matters, but actually it's really interactive as well. So it's not just a whole load of reading and self-study to go away and do. There's interactive activities that we'll take part in. There's videos embedded in there as well. And equally, you know, there is options for us to really work with you as a business to look at how we can personalize those elements as well. So it's a really interactive platform. If you do want any further information on the platform, then we can share that with you as well. And I suppose to wrap up, sort of why Paragon Skills? Why do we feel like we're the best training provider in the care sector? And I suppose it's that quality first approach, you know, delivering high achievement rates, ensuring the best possible outcome for every learner every time. The industry expertise that we've got, the high quality personal tutors that we work with. All of our tutors are employed by us, and as I say, we do have that national reach, but we also have that regional feel, which is really nice. It ensures that those personal tutors that are working in that particular area understand the challenges of that area and that particular setting that they're in. We are #1 rated across multiple awards, and we are Ofsted Grade 2, and we absolutely believe that this is everything that's the key to success for a partnership within the apprenticeship programme. So we'll open it up to any questions. I don't know if we've had any on the chat. Sarah's in the background monitoring the questions for us. Have we had any questions come through, Sarah?
No questions at the moment. Actually, one question come through on dedicated training. So if you could maybe give a bit of an overview what that looks like.
Yeah, it's a great question, and I suppose when we refer to dedicated training, people might think, "Oh, that's a new terminology." Essentially, it's the old 20% off the job, but it has been changed with a new reform, and that language is now being used as dedicated training time or specific training time. And what that actually means is the time that's taken to dedicate towards the programme. It doesn't mean time that's going to be outside of the workplace. It means that it's giving stretch activities towards the programme to help progress that individual on their programme. And we've got some specific examples actually, Sarah. I think we included a slide because we thought this might come up. So if we just skip to those specific activities that could be included, what we want to ensure is that businesses, you know, can see the value in this programme and not see that it's time that's going to be taken away from the business. What we don't want is people to be backfilling with agencies, but actually what we do want them to see is the value in the activities that those individuals are going to be doing. So whether that's learning new skills by work shadowing, it might be personal development discussions and planning for those. It might be employer inductions or training courses that are relevant to the apprenticeship. It might be meeting with new customers or new patients coming into the setting or service. All of those elements will contribute to dedicated time towards the programme. Of course, there is time that they'll need to do self-study as well. I think there is another slide on examples actually, Sarah, if we just flick to that one. Oh, maybe there wasn't. But yeah, so, oh, there we go. So academic writing, leading emotional intelligence, SWOT analysis, 360 review. So the individuals will be asked to get feedback from their team members. So how am I doing in my role? How do you feel about my role? And getting that 360 review. It's really important for that self-reflection as well. And as we say, there is that self-study involved in there as well. So yeah, we'll flip back to the any questions slide. Do have a think if there are any questions.
I've had a couple of questions actually, Gemma, come through while she was talking about that. So one question is, can registered managers do the course?
That's a great question, Lisa. I'll hand that one to you.
It depends on their roles and responsibilities that they do at the moment. So if they are in a management role, but they're working within teams, say, for example, it may be a domiciliary role where they have been working with multidisciplinary teams, where they're looking at ongoing packages of care for those individuals that need it. And they've got, and you know, looking at the overview from the apprenticeship programme, they can definitely work towards that as well. Absolutely, yes.
And that's probably a good question, actually, Lisa, because I know I was asked it recently, is do you actually need to be in a management position to be able to achieve this apprenticeship?
No, this is about an associate coordinator. So it's somebody that pulls, you know, all professionals together. They coordinate, they oversee, they delegate. They need leadership qualities, which they'll learn. And also we talked about emotional intelligence and emotional awareness. They're looking about coaching and mentoring, supporting others, but they do collaborate. So there'll be somebody that has excellent communication skills, the ability to delegate, the ability to, you know, problem solve. And it's looking at, you know, making sure that they do that in a way which brings everybody together for that individual's needs. So as long as they've got competencies within those, and they've got those aspirations and they've got those skills and abilities, then actually they can do this programme. Yes, definitely.
Brilliant, thanks, Lisa. Was there another question, Sarah?
Yeah, one more question. Do they need to have a previous qualification? So, for example, a level 2 or a level 3 in adult care?
They have to have at least 2 years experience within that sector. So if they look at their CPD and their career pathway, you know, it's not necessarily that they have to have a diploma, but they need to showcase those competencies to be able to do this standard. This standard actually is a standalone standard. It has no diploma attached to it. So when you're looking at making sure you're putting that right person on the right programme, you're looking at the overview of it to make sure that they're actually doing the role themselves now, and they've got that expertise and competency previously as well. So they don't have to have a certification to say I've got, you know, a level 2, a level 3. What we're looking at is making sure that they've got those knowledge, skills and behaviours. They've got that expertise that they can actually, you know, do the standard to a level where we're going to be putting them through that EPA, that endpoint assessment, where, because it's all about the endpoint assessment, it's all about meeting those knowledge, skills and behaviours within that standard. And within that standard, we've broken them down into that programme to highlight the expectations and what's needed within that as well. Yeah. Brilliant. I hope that's answered your question.
Is there any more?
No, that's it now.
Perfect. All right, well, if anybody does think of any questions after this, we are going to send out today's presentation. We'll send the slides out. I guess if we just skip to the next...
Gemma, we've just had one question come through whilst you were talking there, which is around the funding and the cost of the course.
Great question. Yeah, so it is all funded, fully funded by your apprenticeship levy. The overall cost is 10,000, and that is, we do charge cap for that. So there's no additional cost outside of your levy. If you aren't a levy payer, you'll be paying 5% of that. So yeah, hopefully that answers that question as well. Perfect. So if there aren't any more questions, as I say, please do send them in if you do think of anything. You might step away and think, oh, it was a lot of information, but now I've just thought, or you might digest the information. Me and Lisa are reflectors, aren't we, Lisa? So we'll come away and think of a load of questions ourselves. But do get in touch. As I say, we will send out the slides from today. If you are interested in this programme or any of the other programmes that we offer, we're really here to help and support you with aligning those to your businesses, to the individuals, to get the right people on the right programme. So do get in touch, and thank you very much for your time today. We have put an email on there. If you haven't already got my email, I'm Gemma Hall, so you can feel free to reach out to myself or your Paragon professional who can support you with any questions that you might have. But once again, thank you so much for your time today. Enjoy the rest of your day, and do feel free to reach out. Thanks very much, everyone. Thanks, Lisa. Thanks, Sarah.
Thank you. Thanks, Gemma. Thanks, everybody. Have a wonderful day.
Bye.
Thank you. Bye-bye.